Welcome everybody. I'm Dr. Huffer of Polaris Family and Sport Chiropractic. Have you ever noticed how there's very few things which are more important than your health? I mean, you can lose your house, your car, or your job, but you can always get a new one. But if you lose your health, time just seems to stand still and nothing else really seems to matter. So what I want to do is to show you today how to be as healthy as possible, what actually controls your health internally, and how you can be a good steward of your own health. So let's just start by asking you, what are we told we're supposed to do in order to be as healthy as possible? Well, we've always been told, eat right, get plenty of rest, plenty of exercise, drink good fluids, plenty of water, increase your vitamin and supplement intake, don't stress, don't smoke, and don't be sedentary. So continue to do those things. Those are excellent things to do externally so that you can be healthy. But have you ever thought about what controls your health internally, intrinsically inside of your body? It's actually the nervous system. The nervous system is called the master system of the body because you see it controls all the other systems of the body. You can see from the chart over here that the nervous system controls the circulatory system, which is all your blood. It controls your endocrine system, all of your hormones. It controls your immune system, your body's natural defense mechanisms. Your cardiovascular system is controlled by the nervous system, the respiratory system, the digestive system, reproductive system, the urinary tract system, the integumentary system, which is your skin, is controlled by the nervous system. The articular system, your joints of your body, are controlled by the nervous system, and the muscular system is controlled by the nervous system. So everything is controlled and governed by that nervous system. Matter of fact, the nervous system controls every cell, tissue, organ, system of the body. So if you have an optimal functioning nervous system, you'll have more optimal health because your body will be healthy and all those different systems will be healthier. So the nervous system is so incredibly vital and important that the designer made you in such a way where it's protected, the nervous system that is protected by bone. So the brain is encapsulated by the immovable skull, which sits up here, and the extension of the brain, the spinal cord, is protected by the movable spinal column. And the spinal column has 24 individual block bones that sit up on top of each other like building blocks do, and they're separated by a spongy pad, and that spongy pad is called a disc. So the disc has a twofold function. It acts as a ball bearing to allow your spine to be able to move and go different directions, but it also acts as a cushion and a shock absorber to protect these delicate nerves which come out in between each one of these vertebrae. So as long as the spine is in the proper alignment and there's no obstruction, misalignment, or dysfunction to those segments, then the nervous system can work well and your body can function optimally. But when the bones are shifted out of position like this, let me get you a close-up, it will cause endangering stress to that nerve, and wherever that nerve goes to, it will cause some unwanted problems. So say if that nerve goes into the legs or into the back, it can cause sciatica or back pain, or the nerves in the lower part go into the bowel and the bladder. It can cause things like digestive disorders, constipation, diarrhea, or urinary tract infections, bladder infections, kidney infections. There's also the nerves go to the uterus, so it can cause cycle cramping, dysmenorrhea, PMS symptoms, because the uterus is a muscle as well. The nerves also control the prostate, so there can be problems in that area. So also if the subluxations occur in the upper part of the spine and the cervical region of the spine, then it can cause problems up into the head and neck area and into the arms and the shoulders. So it can cause headaches and dizziness and vertigo, tinnitus, which is ringing in the ears. It can cause brachial neuralgia, problems down the arms, carpal tunnel, shoulder, elbow problems, pain between the shoulder blades. It can also cause things like high blood pressure, asthma, reflux, and on and on. So you see where I'm going with that. So that's why it's so vitally important to make sure that we're getting our spines checked on a regular basis. Now the scary part about these subluxations, let me show you again what a subluxation looks like. When a bone shifts out of position, you can see how that bone, the whole joint is compromised, and it puts pressure up on that nerve, okay? So the scary part about those subluxations is most of the time there's no pain associated with subluxations. The reason for that is because only 10% of the nerves in the spine control pain. The other 90% of the nerves go to the different organs and systems of the body. So again, it's vitally important that we're getting that checked. It's much like somebody who has a cavity in their tooth. There's no pain with a cavity, but if that's left undetected and uncorrected, it progresses to a much more advanced stage, which is more like a root canal or an extraction. Then pain is detected. So pain is always at the end stage, typically. Same thing goes with high blood pressure. There's no pain with high blood pressure until it progresses to a more advanced stage, like a heart attack or stroke. But you see how that's a much more advanced stage. So it's vitally important to get those checked before pain ensues. And the same thing goes with cancer. Pain doesn't come on until stage 4 typically. And the same thing with diabetes. It doesn't come on until there's a Charcot joint, which causes an amputation, which would require an amputation. So the same thing goes with these subluxations. Subluxations can be detected and corrected early, but usually there's no pain in the early stages. If they're left undetected and uncorrected, they progress to more advanced stages, and most of the time patients will come in over here, and then we're working more with what's left. So please make sure that you get your spines corrected and then regularly maintain it so that we can take care of your spine both now and in the future. Okay? These subluxations, they can occur in a lot of different ways. Slips, trips, falls, accidents, injuries, the birthing process. Not only is traumatic to mom, but also to the baby with the use of forceps deliveries and vacuum distraction maneuvers and C-section deliveries, very traumatic. In addition, the American Pediatric Association has come out with a statement saying that the average child, by the time they're 5 years of age, has fallen over 500 times on their head. So that sets them up for these unwanted subluxations, predisposing them towards things like ear infections, colic, asthma, GERD, reflux, ADHD, scoliosis, and a host of other unwanted symptoms later on and other associated conditions. Okay. So how do we detect these subluxations? Well, there's a lot of different tests that we do in our office. We do motion scans, motion x-rays, orthopedic nerve tests, EMG scans. The bottom line is we want to make sure there's no guesswork, so we know exactly what's going on. If the patient does indeed have these subluxations, then they need to get them corrected. So how do we correct these subluxations? Well, we use with our hands or an instrument or a special table, and the bone that has been shifted out of its normal alignment, we reset it back into the normal position. And that's much different than, say, treating it with medications, which would just mask the symptoms at best and hasten arthritis, liver disease, and kidney disease. Okay? Does anybody know the #1 cause of liver disease? It's Tylenol. The #1 cause of kidney disease are NSAIDs like aspirin, naproxen, ibuprofen. Now, we're not down on medications. Thank God for medications for crisis situations and medical emergencies. But these subluxations, folks, where's my spine? They're mechanical problems. So when the spine is shifted out of position, that's a mechanical problem. It needs mechanical treatment. If you're treating a mechanical misalignment, a subluxation with a chemical, you're going to be going through a vicious cycle of side effects, and then you need more meds and side effects and more meds, and then it doesn't get to the root cause of the problem, and it eats up those internal organs of the body. And then it leads to stronger, more addictive medications, hence the opioid crisis that we're going through right now. So I hope that makes sense. Let's review a couple of things. The master system of the body is called the nervous system. The misalignment that's involved in the spine is called the subluxation. And then the treatment is the adjustment, okay, the realignment. And that's a very specific adjustment, okay? So I hope everybody has that. So in our office, everybody has a specific blueprint of treatment, has a specific blueprint of treatment for their adjustments, for the specific bones that we're adjusting, and for their rehabilitation. But there are some other basic principles that we want you to be able to know how to do. And so what I'm going to do is show you some golden rules of taking care of your spine so that you know what's good for it and what's bad for it, what's going to help it and what's going to hurt it. So before I tell you these 2 golden rules, okay, I need you to work with me and follow me here. Your spine can move in 3 different directions. It can move in a front to back motion, okay? It can move in a side to side motion, and it can also move in a left to right motion, okay? Front to back, side to side, left to right, okay? So again, I'm going to tell you these 2 rules so that you can apply to everything that you do during your activities of daily living, whether it's good for you or bad for you. Okay, so rule number 1 says don't combine the motions. Don't combine the motions as much as possible. So I don't want to see any of you say rolling your neck. I don't even want to do that one. Say if you roll your neck, you're actually combining all 3 motions. Okay, so if you're in an aerobics class or gym class or trying to stretch your neck, just go through front to back, okay, side to side motions, and left to right motions as opposed to rolling your neck. It actually combines those motions and damages those articular joints in your neck. Okay, another example of not combining the motions is don't flex and rotate and work on, say, your laptop or your computer over here or watch your TV. So what should you do instead of doing it that way? Instead of flexing your head down and rotating, just move your computer monitor right in front of you, or move your chair so you're looking more straight ahead watching TV or your monitor. Another example is if you're sleeping on your stomach. So you're extending your head and then rotating your head, and that causes significant stress to the areas in your neck. So instead of sleeping on your stomach, sleep either on your back or sleep on your side. Okay. So some other examples for your lower back would be if you're sitting in the front seat of your car, don't extend and rotate and get something out of the back seat of your car. You should never do that position. Also, don't flex and twist and get like that tennis ball out of the back of the trunk. Okay, so flexing and twisting is not good. So when you're doing that, just, if you're getting your groceries or something, you can bend, but don't bend and twist at the same time. Okay. What's another example? Say crossing your legs. You're flexing and twisting, crossing your legs. Now, just don't cross at your knee. If you can sit normally with your feet down on the floor, or if you have to cross your legs, cross at your ankles, but don't cross at your knees. That's combining 2 motions. Also doing sit-ups where you're flexing and twisting. That's actually combining 2 motions as well. So just come straight up. If you want to work your obliques, and get on the side and do 1 motion at a time. Okay? Hopefully that makes sense. Rule number 1, don't combine the motions. Kind of take inventory if you're breaking rule number 1 or not. But let's move on to rule number 2. Rule number 2 says in those motions, you can only go so far in each direction. So in the neck, it's 45 degrees extension and flexion, 45 degrees side to side lateral flexion, and 90 degrees left and right rotation. Okay? So the big one for this one, and we always see this, is bringing your chin to your chest. Avoid bringing that chin down to your chest when you're texting, reading a book, or working on your laptop or computer, or even sleeping positions. Get in a position where your head is away from your chest, okay? It's vitally important that you do that, okay? So rule number 2 for the lower back, you have to know the motions. It's 30 degrees in each direction, 30 degrees side to side motion, and 30 degrees left and right rotation. Okay, so the big one here is bending forward at your waist. We've always been told if you want to pick something up off the ground, don't bend at your back, bend how? Bend at your knees, right? Now you know why. Your spine is not designed to go more than 30 degrees. If you go more than 30 degrees, it's going to subluxate that spine typically, if it's done enough, and will cause disc damage and nerve damage, and wherever that nerve goes to, there's going to be some unwanted problems. So bend your knees. Now, if you have a bad knee, or you don't feel like bending your knee, you can use use your arm as a stick and put your hand on your knee and bend over and pick it up. Okay, but please try and stay within rule number 1 and rule number 2 as best you can. Okay, so what you need to do is just think of your activities of daily living. Am I breaking rule number 1? Am I breaking rule number 2? And how can I do it smarter so that I'm not doing that? So I'm doing it in a way that keeps my back and my spine healthy. And sometimes it takes a little experience to figure this out. So you can talk to me or Dr. Phillips, and we can help you here at the office. So please make sure you work together with us. And the patients who really get the best results are the ones who Keep your appointments, stay on those because we have you on a specific regimen of scheduled appointments for you to get the best results. Do the blueprints of exercises and rehab we have you doing. Also, stay within these 2 rules that we're applying here for you, rule number 1 and rule number 2, and also stay in good communication with us, okay? Because it's our purpose and our mission here at this office to be used and to use chiropractic for the glory of God to help as many patients and their families as possible toward optimal health. So if there's anybody in your family that has not been checked, especially in the past year, please take advantage of this offer to have them come into our office. It would be an honor for us to check them, and we will do it at no cost. It's a way for us to get a spinal checkup on them, create a family record, and that way we can detect any early problems, any subluxation problems early before they become a more severe problem. So we want to make sure that you're healthy not only now, but also in the future. And we take your health care very seriously. So if we can ever do anything any better for you, please let us know. Okay, bye for now.